Linda.
Hi, I'm Nick.
Hi, I'm Catherine, and we're going to show you how to take a patient's blood pressure.
Hey, I got it! Oh, ow, ow.
Are you okay? Is it alright if I take your blood pressure?
What's blood pressure?
Blood pressure is a force exerted by the blood onto the internal wall of the blood vessel as it flows through. This is typically expressed as mmHg or millimeters of mercury. Normal blood pressure in adults is 120 systolic over 80 diastolic. This can vary based on gender and age. Males have higher blood pressure and higher risk of cardiovascular disease because they have a greater number of red blood cells. In fact, 25% more red blood cells than females of similar size, due to the fact that males have more skeletal muscle mass. Their blood is also more viscous because there are more red blood cells, so the heart has to work harder to pump, therefore increasing blood pressure. Hi, I'm Nick. What is your name and date of birth?
Hi, I'm Linda. Date of birth is July 27, 95.
Alright, is it alright if I take your blood pressure and record it for the purpose of teaching other students?
Yes, of course!
Always use hand sanitizer.
This is a stethoscope, and before every single patient, we just like to disinfect.
In addition to the stethoscope, we have a sphygmomanometer, a blood pressure cuff, and a bulb. So right here, I'm feeling her brachial pulse on her brachial artery to line it up and where to put the stethoscope.
So now we line this symbol up with the brachial artery and wrap the cuff around tight enough so it's not going to fall off.
So for the stethoscope, you want to make sure that it's facing this way on the patient's brachial artery.
Place the stethoscope on the brachial artery. Normally you'll want to pump to 20 millimeters of mercury above the patient's normal blood pressure, but if you don't know, you can go close to 160.
Once you reach 20 millimeters of mercury above the patient's blood pressure, you can slowly turn the valve to release the air from the bulb.
As you're releasing, the first beat you should hear is the systolic, and then when the heartbeat stops, that is the diastolic.
Systolic pressure refers to the pressure within an artery when it's maximally stretched during the contraction of the heart. When the heart contracts, it will push blood into the aorta, stretching it maximally. The normal value for this is 120 millimeters of mercury. Diastolic pressure refers to the pressure within the aorta or blood vessel when the heart relaxes and the aorta returns to its original size. The typical value for this is 80 millimeters of mercury.
As we age, the blood pressure increases because the arteries become less elastic and therefore they cannot regularly stretch as the blood flows through them. The pulse pressure is equal to the systolic minus the diastolic, and it's normally 40 millimeters of mercury.
It is important to regularly check blood pressure to ensure you do not have hypertension. Hypertension is an extremely common cardiovascular condition that can contribute to a number of additional health concerns, such as coronary heart disease, stroke, atherosclerosis, and even death.
It's also important to measure blood pressure to avoid being hypotensive. Hypotension causes inadequate flow of blood to the body's organs and therefore decreases the supply of oxygen and nutrients to the body cells that are needed to perform cellular respiration to generate ATP. Hypotension can also lead to strokes as well as heart attacks and kidney failure.
Some tips to maintain a healthy blood pressure are to exercise regularly, reduce your stress, and maintain a healthy diet. Exercising regularly is important to avoid obesity and therefore prevent angiogenesis, which is the formation of new blood vessels in adipose tissue that carry nutrients to that tissue. Angiogenesis increases the length of those blood vessels, which also increases the total peripheral resistance of blood flow, which additionally increases blood pressure.
Maintaining a low stress level is beneficial to your health to reduce the release of short-term stress hormones such as epinephrine and long-term stress hormone such as cortisol, from the adrenal gland in your body. Epinephrine increases blood pressure in several ways, one of which is by constriction of blood vessels and therefore increasing total peripheral resistance, increasing the blood pressure. Cortisol is released during chronic stress when the body detects low levels of glucose. Cortisol will increase glucose levels, leading to higher viscosity of the blood, forcing the heart to work harder to pump, and therefore increasing blood pressure.
When maintaining your diet, it's important to watch where you eat and to read the nutrition labels. It's ideal to consume food that contains greater amounts of high-density lipoprotein and less low-density lipoprotein. Omega-3 fatty acids are usually found in fish and act as vasodilators, which increases the diameter of blood vessels. It's also important to limit sodium consumption to avoid high blood pressure because water follows solute movement into and out of cells, increasing the pressure. In addition to sodium, sugar consumption should be limited because, as we mentioned earlier, more glucose increases blood viscosity and also blood pressure.